Hi, I'm Suzanne. I'm retired. I've been with Dr. Samadian since 2016, 2015. I'm a very active old lady who likes to get in trouble and likes to get hurt, so he keeps fixing my teeth, and this is my second appliance that we put in. Dr. Samadian was full-time, and we jumped right into doing the measurements and working on my mouth, and we got it at the tail end of where it wouldn't have been successful because of needing several bone grafts on my lower jaw. Dr. Samadian has really supported me through extensive dental reconstruction, not once, but twice. I am very, very comfortable and very confident in his suggestions, his ability to openly discuss, make choices not for me, but with me. He's become a friend. Everybody in the office is very attentive to my medical needs, whether it's been working on my disappearing upper lip for smiling, my bone grafts, or my injuries from my back and keeping me in that chair safe and comfortable and making their job that much easier. He's available. If I had a problem, if I was saying that I had sleep apnea, I know I could go to him and discuss it and get his impression from the dentistry end of it, medical end of it. That breathing, and I do have a little bit of allergies and periodically, and when that happens, it makes your mouth, whether you have your teeth or not, it can make your mouth and your jaw hurt. And I can talk to him about anything like that and know that he's going to be there with recommendations. I had a choice, yes, but he came with the credentials that we just hadn't crossed paths yet. I met Dr. Samadian, and it was after the first cleaning. I knew what he was able to do at that point, and I knew that his credentials were good. Normally, for me to go to someone, anyone, I'm going to go in and I'm going to interview you like I was going to hire you as my employee, because you are giving me service, and can we work together? And this man has put up and taken care of and given me the smile that I have right now, even though I'm still extremely difficult with smiling and uncomfortable with it. And that's just some family history I don't need to go into, but other reasons, like I have the disappearing upper lip. I don't have the tooth. And he's worked on the development of my appliance and how it looks, and using what little I have, helping the appliance to show off my little bit to be more. Lots of x-rays, 3Ds, lots of talking. Right, my first appliance. Is that what you're talking about? I mean, up for me to get to the point of actually having the appliance in my mouth complete was for me about 3.5 years, because of the extensive work that we had to do to get to that point of even installing implants. I have 15 in my mouth total. We're using currently 10. We put in extras because of how much bone loss from medicines that were given to me when I was a child. I had only, when he started doing the surgery day, finally came after all the x-rays and him planning on where each individual implant was going to go and how it was going to grab into the bone. And he actually had me with him one day, sit down, and he spent the time and worked on lining up to do the install for one. So I understood why it was taking so long, because he had 15 of these to do, and each one takes at least an hour or more to set. So that's a minimum of 15 hours. And the surgery alone, I was there from 8:30 until 5 at least, with no breaks for lunch or anything. The most amazing thing is on the stitching on the lower jaw, when after doing the bone implant where he had to stitch underneath the tongue. I'm still to this day amazed at what he's able to do. So all the healing and top applying, and then also taking, after the gums healed, then doing all the impressions. We had another bone graft, and then we had some more testing, setting up and impressions. So it was 2019, probably May was the first time I had a total full mouth of teeth without problems since I was 25. And then in 2021, I promptly fell backwards out of our 4x4 camping with my girlfriends, and I micro-fractured my entire appliance, upper and lower. We nurtured that along and replaced a couple of teeth once or twice and glued them back in, and then finally the micro-fractures took the best of us. And last May, I have installed a brand new new zirconia appliance, and I love it. It's so much easier to clean. It feels good. And with this zirconia, I get that feeling every day after I brush my teeth and hit it with the water massage. And I just follow what he does. They went over with me how to use it to make sure I was getting up and under and in between the gaps, and do it from the front side and do it from the inside. I pour some mouthwash, no dye in it, no harsh chemicals, no alcohol. And so that also runs through there. So it keeps my gums real healthy. So when I go in for a cleaning, they look at me and go, oh, you look good. And I have to sit there and wait till my appliance is clean and we screw it back in. But this time, metal trays with goo to squeeze on. It was all done with 3D X-ray device, handheld, that was wonderful. And all the attention to detail that Dr. Samadian and his team do to make sure that it is right, that the teeth are the color that I want, the size that I want, the gum color, the whole thing, that it looks good. There were a couple of teeth they didn't care for the way they were, as I said, about getting enough upper lip, get the angle out just a little bit more to get a little more skin up and over so it didn't disappear as much. And it's those loving, kind attention to details that why I recommend doctor's office to everybody and anybody that has, whether they want just a cleaning or whether they have other work to be done. Everybody has really been outstanding through the years. I drive sometimes 4.5 to 6 hours when I'm at our other place a ways from here. I'll come down and I make sure I keep my appointments. I book them 6 months in advance and I book everything else around that appointment. That's how important his care is to me. At least I wasn't afraid to open my mouth. I mean, I had full dentures before. So, and I still had, even when my gums were healing from the major surgery, I still had my dentures in. And then I got the upper in, and then we just had the bottom going on. You know, it's been so long, and I'm not one that harps and remembers the bad stuff or what it was. I look for tomorrow, and I know that it's just a progression of change, and I can tell you that this one is so much better.